Hi, I'm Steve Adler. Got a minute? So how you guys feeling today? Hope you're doing okay. Take your temperature every once in a while. We're doing good. Hope you are too. So everybody's trying to do this physical distancing. We're doing a pretty good job. I just want you to see how we're doing over time. You know, this is about where we were. This is our normal condition. Then we put in the rule about no restaurants, no bars. We went down. We started coming up a little bit. That's when we put in the real orders for the sheltering at home. You can see we went down again. And then about mid last week, we had some really pretty days and our numbers started going back up again. We don't have the numbers for the last 4 days. This lags a little bit, and I hope when we get the numbers, we've gone down again. But the more we do this physical distancing, this physical separation, the better we're going to be in terms of narrowing that curve. Numbers for us today: 484 people with confirmed cases. 6 people have passed away. This 484 number represents about a 5% increase where we were yesterday. Remember, yesterday's increase was about 18% over where we had been before. You know, those percentage increases, not day to day, but kind of in a trend, are real important things to take a look at, because we don't want the number of people that are being hospitalized or getting sick to double very quickly. And the percentages that we have in the city tell us that. So a 15% increase is a doubling every 5 days. A 7.5% increase, we're doubling every 10 days. A 5% increase would have us doubling every 14 days. I don't know that we can sustain that right now, but that's the number we're trying to get down to. New York and the United States, we're looking at a doubling every 2 days, and that's where we started off. Right now, we're probably doubling every 5 days, and that's a really good number, but we need to continue to do better. We're tracking the number of people that we test positive, but I think we're going to start showing a different number here shortly and start talking about the number of people who actually get hospitalized. Probably a better number, because the people who are confirmed are in part dependent on how many tests we give. The more tests we give, the more people we would hope to find in our community that have the virus. So it's probably a more objective number to look at over time. And I think the modeling that we're going to get from the University of Texas and Dell Medical School tomorrow, the next day, is going to be focusing on the number of people in our community that are hospitalized. About 70 or so, a little over 70 in our community right now that are hospitalized. What I want to talk about mostly tonight is covering our faces with face coverings. We know that the CDC nationally has recommended that people cover their faces with face covering. Tomorrow or tonight, the county judge and I and Dr. Escott are formally requesting and recommending that everybody in our community have a face covering when you go outside. I want to talk about that for just a second. There's a difference between a face covering and a mask. The masks we see, those N95 masks, surgical masks, those are precious commodities right now. We need to save those and get those to our healthcare professionals that are on the front line, to our EMS, to our first responders. Those are the people that should be having those kind of masks. And if you have any where you work or at home, please donate those because those folks, our first responders, could really use those. But what about the rest of us? We're going to recommend now that everybody put on some kind of cloth face covering. You know, you can do that pretty easily just with the things that you have at home. But I will, a couple of pointers on that. You're trying to get something that covers your nose and also covers your mouth. It's got to be something that feels comfortable enough that you're not touching your face to fiddle with it. But it's also important to know that wearing a face covering like that doesn't prevent you from getting the virus, because, you know, your face is like unexposed, your hand, the rest of your body is unexposed. But what it does do is it decreases the chances that if you have the virus and are asymptomatic, you don't have symptoms, but you can still be contagious, face mask decreases the possibility that you're going to give the virus to somebody else. So for example, if you go to the grocery store, you should wear this face mask, a face covering on yourself to help the clerks in the store not get sick. And if everybody in the community all wears face coverings, well then you're protected too from more and more people, because more and more people then are not being able to infect you. It's not perfect, which is why even with a face cover, you have to maintain the 6 foot of distance. So here, armed with my my assistant, Diane, I'm going to show you how to make a face covering from things just in the house. There are lots of different ways to do it. Some of them are pretty good. You go on YouTube or iTunes. You can get recommendations on how to get that done. I'm going to show you how to do 2 tonight. I'm start with a T-shirt that I just cut. So I got a rectangle here. It's about 2 feet by 1.5 feet. And I'm going to show you in less than a minute, I'm going to show you how to turn this into a face mask. Ready? Start the clock. So, before you go down, the clock's running. People don't think that I know what a minute is, because I say, do you have a minute? And then I speak for like 5, 6, 7, 8 minutes. But I really do know exactly what a minute is. In fact, the minute clock started a little bit ago. All right, so let's keep going, because we're going to get this done in that minute. I have this piece of material here. I'm going to fold this to the middle. I'm going to fold this to the middle. And then I'm going to fold it to the middle again and fold it to the middle again. I have 2 rubber bands. I'm going to take a rubber band, put it on this side, and a rubber band, put it on this side. And then I'm going to fold both of these to the middle. And I have a mask created in less than a minute. I'm going to put this on just so that you can see how this mask works. Pretty good, huh? Less than a minute. Put on the mask. Put it around your ears. Cover your nose and your mouth. Voila. Here's the mask in less than a minute. These are going to become fashion statements in our community, right? Everybody's going to have one that says a lot about themselves. I want to show you a second one. Here's another kind of mask to make. I took that same piece of material, I folded it over, and then I cut down this side, and then here, leaving me this. This is a mask. I take this mask, I want to double over the material, because if you can make one that has a doubled over material, that's a better way to do it. I then take this mask, and Diane, if you would help me here, please. I take this, I can tie this in the back. I can take this other tie and tie it on top of my head or behind the head. And again, just another fashion statement. And in a matter of moments, with materials that I have and you have probably at home, in this case they were just like old T-shirts, we have a mask. And it'll stay up. So, different people are going to have different kinds of masks. Many of them will look better than the mask that I have. But they're really easy to do. And you can find, you could use bandanas in your house. You can use gaiters in your house. A lot of different things you can use. I'm going to get excited to see what everybody in the city does. I'm going to conclude by talking about the Cunahan family. They had a birthday party. They gathered the whole family for their birthday party. The birthday girl has an autoimmune disease, so this was really the best way for her to gather with her immediate family. Everybody was there, including her 97-year-old grandmother, who's in a care facility, so she's not even going out of her room to get meals. But This was, that she says, one of the most wonderful birthdays that she's ever celebrated. With this new technology, they could even have breakout sessions with different parts of the family talking. See, this is the time for everybody to get more technologically learned. So, I want everybody to take care of themselves, and I'll get back to you as soon as I can.